So normal lung mein we see this is the part which is already static, the chest wall and the skin and the subcutaneous tissue. So this part is correlating to this part. No motion, chest wall. Just straight waves like barcode. Nothing happening. But the lung is a very happening place. A lot of micro movement is happening with every respiration. So here you can see the positive lung motion. That is the sand. Lung is like the sand, the small granularity. The sand is the lung which is moving. So this is the pleural line. This is the pleural line. Above this, there is no motion. Below this, there is yes motion. Now what happens in pneumothorax? There is no motion whatsoever. So this is the pleural line. Above also no motion, below also no motion. So appearing like a continuous barcode or a stratosphere sign. Okay. Now, this is your M mode. Understood? But what will you see in your B mode? The lung sliding, right? So there is a place where the lung sliding is happening, and all of a sudden there comes a transition point, and this part may there is no lung sliding. So that is the transition point or the lung point. Understood? Which you can see in your B mode scanning. So M mode pe you see these specific things, the stratosphere, barcode, seashore. But on a normal convex probe, your B mode pe, what will you see? The lung sliding is gone. And there is a point of transition which comes normal healthy lung versus the area of pneumothorax. That is your lung point or the transition point. Sliding present, sliding absent. Normal healthy lung, pneumothorax wala lung. Between the two, the transition point is the lung point. That lung point you can see on your M mode also. So this is the normal healthy lung where the sliding is present. Healthy lung, normal lung, sliding is present. So seashore, this is the abnormal lung or pneumothorax where there is no sliding. And the point of transition between the two is going to be the lung point. Nothing big at all. Understood? समझ में आ गया सबको? So normal जब आप convex probe रखोगे, you are seeing the lung. Just now we saw the video. They were doing with the convex probe. You can do with any probe. Convex probe, linear probe, nothing like that. Lung sliding versus no sliding. That is grayscale. That is B mode. On M mode, you're going to see this motion, this specific signs. Key seashore sign versus barcode sign. That is M mode. Everything else is B mode. Only this is M mode. Only this is M mode. Everything else is B mode. Understood? Routine is B mode. Now they're telling you there are 4 main sonographic signs of a pneumothorax. So what all you can see? Okay, because one sign may not always help. So we have more, the merrier. So one is your lung sliding. Just now the video that we saw, the pleural line is moving with every respiration. Simple thing. That is lung sliding. Second is your B lines. Understood? So if there is pneumothorax, will there be B lines? You tell me. Then lung point, I taught you right now, the transition point. Okay? These 3 things are very simple and clear. Lung sliding will be absent in pneumothorax. Lung point will be seen at the transition point. B lines will be present or absent. What about the B lines? And then comes the lung pulse. Okay, so B lines are going to be absent. Very good. Because I told you the part of it. Let's see the image. Yeah. So B lines are going to start from this pleural line. They are going to start from the pleural line all the way downwards. Now, when here this thing is also not there. Now this pleural line is gone. There is a lot of fluid or there is a lot of air which is separating the two pleura. So starting point of B line is only not there. How will it go and further propagate? Starting point of B line also asks for apposition between parietal pleura and visceral pleura. When there is no apposition, there is no B line. So these are the 4 signs. Now you will ask me what is lung pulse. Okay? So very simple. Just simple. Let's not complicate things. I will read it out a bit to you. I will read out one small paragraph. Listen carefully. I've written this down in simplest language possible, and then I'll try to explain again. So what is the lung pulse? Listen. It occurs when lung is not inflating. Lung is not inflating. Why? Maybe because of collapse, something like that. Lung is not inflating. But the two pleura, the visceral pleura and parietal pleura, they are still in contact with each other. It is just that the lung is not inflating. The patient is having very poor respiratory effort, he's having a lot of restrictive lung disease, or because of a large collapse of the lung has happened, the respiratory effort is poor, he's having some muscular dystrophy, so the breathing and the respiratory this thing is not good efforts. Understood? So anytime the lung is not inflating properly, whatever may be the reason, but the visceral and parietal pleura are still in contact with each other, so then you see something called as a lung pulse. Okay. So why does this happen? Normally what happens when there is absolutely normal lung, which is inflating also nicely with a good respiratory effort, so the pleura comes and goes, that smooth sliding movement you can see. And after that sliding movement, you see nothing. Because the sliding movement is the most dominant thing in a normal lung. That echogenic pleura, which is sliding, that's it. Now, what happens in a lung which is not inflating properly, which is having a very weak respiratory effort, or a large collapse has happened? Now, the breathing movement is poor. The sliding will be there, but it will be a little less sliding. Sliding will still be there, but it will be a bit weaker. The exertion, respiratory efforts are poorer. The lung is not inflating. So, the sliding sign may be present, but it is going to be weak. So because the predominant artifact or the predominant sliding sign is now a little bit weaker, you see the other more subtle artifacts, which is because of cardiac pulsations. So with every breath, you will still see the pleural line, you will still see the lung sliding, because it's not a pneumothorax. The parietal and visceral pleura are still in contact, they're still friends. But the sliding movement is a bit weak now. So your attention goes to other things. So there are cardiac pulsations which are transmitted to this pleura, which is showing a weaker sliding. And these transmitted pulsations with every heartbeat is going to show this little bit of tiny micro movement in your M mode recording. And it is called as the lung pulse, because it is happening because of cardiac pulsations in the lung, in the pleural line. You are seeing these small undulations. That is called as a lung pulse. So lung pulse means that the visceral and parietal pleura are still in contact. That means if lung pulse is seen, there is some pathology of the lung, there is a collapse or the respiratory effort is not good, but it is never pneumothorax. So if a lung pulse is seen, it rules out pneumothorax. As simple as that. Just an additional sign, not that high level or not that very, very important. Other three signs you should have understood. This is like another sign extra. So four signs are there. So first and foremost, lung sliding is gone in a pneumothorax. Number two, the lung point will be seen as a transition between healthy lung and the pneumothorax wala area. The third thing you have to know, the B lines will not be seen, because again the pleura are now no more in contact. And lung pulse will what? Not be seen. For a lung pulse to be seen, the two pleural layers should be in contact with each other. So if the two pleura are not in contact with each other, even the lung pulse will not be seen.